Screen. So today's session, inshallah, first of all, assalamu alaikum warahmatullah, everybody. I'm very excited to be here with you guys. Today's session, we're going to make, let me see if I can move some of these things my way. We'll be talking about making the best choices for you as we go into, we just started the open enrollment period. So there's a lot of changes that are happening as we go into 2025. I'll kind of walk you guys through that. Today's intention is to kind of give everybody a little bit of a background of how Medicare works, the overview. I think most people will be familiar with that. So the objective is that we'll talk about what the annual enrollment period is and what that means. We'll walk through Medicare Advantage and Medicare Supplement plans so that people can understand the key differences of that. And then we'll talk about networks because medical networks is important for people who take Medicare Advantage plans, and then understanding the implications there. And then the last part, we'll talk through the prescription drug coverages, because this is really where the Inflation Reduction Act comes into play. And so we'll talk about why formularies matter when it comes to prescription coverage, and then what that Inflation Reduction Act is doing to Medicare in general. And then we'll end with some tips on how you can prepare for the annual enrollment period and making plan changes as we end the 2024 year and get ready for 2025. Any questions on the agenda here, guys? Okay, so I'll start by just first and foremost going through my disclosures. I don't work for Medicare, the government, but I do work as an independent broker. And so I'm actually contracted with several different insurance companies. Last year, when you guys had seen, this list was much smaller. It's grown. Mainly because for two reasons. One is I've started to expand my reach out to other states. And so other states have different insurance companies. But even within California, you can see UCLA Health has now started offering their own health plans for people who live in the LA County area and want to access UCLA doctors. A lot of these I'll say like larger medical systems have started to step away from Medicare Advantage plans that are offered by broader companies, and they want to offer their own catered program. So UCLA Health is a perfect example of that. And then LA Care is an example of another plan that's primarily focused more in the LA County area. Cal Optima is more for Orange County residents. And so, again, the reach kind of starts to extend out. Again, my other point here is I am an independent broker. I don't work for Medicare. Like I said, I don't work for one individual insurance company. I am here to be able to offer and cater to each individual's needs. And inshallah, I'll be able to offer a product that makes sense for you guys. And then anybody that you guys work with, whether it's me or anybody else, just make sure that you guys have the trust in that person that you're working with, and it's not just somebody that you got a phone call from and you've never met or talked to them before. There is a lot of things that are out there that are happening where people are just trying to, switch people's plans, make a commission, and they're not being transparent about what's happening, nor are they necessarily being fully thoughtful about what they're recommending. My approach is always to build my trust with my clients and also be able to be very transparent about how things work, and then also very thoughtful about each person's individual needs. So that's just kind of a background on myself and the disclosures that I have to kind of share with you guys. Any questions so far? No. Okay. So again, feel free to get off of mute. Is everybody comfortable with being able to get off of mute? Maybe. Let me see if I can see if people are on camera. If you can maybe show of hands if you're comfortable with being able to get off of mute and ask questions. Okay. Very good. Perfect. So we'll kind of talk about the annual enrollment period. This happens every single year, and these dates are set pretty much in stone for every year. So Medicare annual enrollment starts on October 15, which was last week. Last Tuesday is when it started. It ends on December 7th. This is your annual period where you can make a change. If you're in a Medicare Advantage plan, this is when you change from one Medicare Advantage plan to another. Or if you have a prescription drug plan, that's what we call a standalone prescription drug plan. You can change your prescription drug plan in the annual enrollment period. All of these changes become effective on January 1st. Now, if you have what's called a Medicare supplement plan, that you can change throughout the year. That's not a problem. But usually when you have a Medicare supplement plan, it pairs with this prescription drug plan over here, a separate prescription drug plan. Most Medicare Advantage plans have this prescription drug plan built in, but this is the time to make those changes if you want to either change one of these two options. So I know that gets a little bit confusing in the details, but I'm going to walk you guys through what the difference is between a Medicare Advantage plan and a supplement plan here in just a second. But most of you, if you're already on a plan, around the end of September, maybe beginning of October, you would have started to see letters come from your existing insurance companies called the annual notice of change. The annual notice of change basically comes in and says, hey, for your plan that you're on this year, these are the changes that are happening to it starting on January 1st. They have to give you that heads up before the annual enrollment period. That way, if you say, hey, if I'm losing a certain benefit, I want to know about that so you can make those changes as you prepare for 2025. The one thing I will tell you is that this year, because of the changes that are stemming from the Inflation Reduction Act, a lot of insurance companies have made pretty significant changes to their plans because a lot of the cost is being shifted back to the insurance company. And so for their side, they're basically compensating it by reducing benefits in certain areas. Not every insurance company is doing that, but I will say that there's a fair amount of changes that are happening. And sometimes insurance companies will say, hey, we're no longer going to offer a particular Medicare Advantage plan, and they'll tell you that it's going to be canceled for 2025 and you have to find a different option. And again, this is where it's always beneficial for us to be able to have a one-on-one conversation if we ever need to. And after this call, inshallah, I'll share a link with Zainab and the Olive leadership so that they can share that back with you guys. If anybody needs to schedule a one-on-one appointment, please make sure you take advantage of that during this period so that we can kind of review your situation. The one thing I'll tell you is a lot of people ask me, Javad, just tell us what's the best plan and we'll just go with that. The unfortunate thing is that there isn't one best plan that fits everybody's need. Every person is individual in a different situation from a health standpoint to a financial standpoint. The needs that they have, they all vary. And so I can't say there's one best plan that fits everybody's needs. And so that's why it's important for us to make sure that we have those individual conversations as needed. Okay. So inshallah, that makes sense. This next picture is really just to kind of show you guys that window that we have for those changes. I would definitely avoid waiting last minute to schedule anything if you need that, because as you can imagine, at the end of November, Thanksgiving comes, people's families are in, so they get busy. And then as we get closer to December 7th, a lot of people start to schedule appointments and then the calendar starts getting booked up. But that's kind of how this works. I will tell you one other thing, just from an educational standpoint. If you make a plan change now as we close out the year, and then that plan change is effective January 1st, if something happens where either a change through that you elected to make with me or anybody else on January 1st, if you're in a Medicare Advantage plan, there's an open enrollment that happens from January to the end of March that you can make another change. But again, it just depends on which plan you're on that would allow you to take advantage of that. But there is a little bit of a window that happens from January to March. The only thing is that as agents, we're not allowed to market that in the sense of like advertising, oh, there's another window to change. I can educate you to tell you that there is that change window, but you're not going to hear a lot about it in January. That's really intended for people who make that change. They get in a plan and they're like, oh my gosh, I got in a plan and I don't like this plan. And so that window from January to March gives you an opportunity to get things corrected for the rest of the year, inshallah. So that's kind of how these windows work for annual enrollment. Any questions so far? Make sure I can see. Everybody's good?
Hello?
Yes.
Yes, I have a question.
Sure.
I have, on my card, it says so many different letters, and I don't understand that they all mean. I have United Health Complete Care, and then it says CA020P, and then in the bracket, it says HMO-POS-C-SNP. And I do not understand all those words, how they.
So on your card, do you see that it says that you have it's called a Medicare Advantage plan? It says that probably in the bottom part of your card. Is that correct?
It doesn't say, but I do have Advantage, but it doesn't say on my card.
Oh, okay. It should say somewhere on there. It should say Medicare Advantage. It might be not in such prominent letters, but everything that you just described, for me, I can pretty much tell you you're right. And you know it as well, that it is an Advantage plan.
Yes,
So that's a United Healthcare Advantage plan. And we can definitely take a look at that to see if that's the right plan for you going into 2025,
yes.
or if there's something better for you, inshallah.
Okay,
Yeah,
inshallah. Okay, thank you.
no problem. Good question. Yeah, sometimes people don't know exactly what they have, but Famida Auntie knew that she had an Advantage plan, so that's definitely helpful. That's good to know. Um, on this next slide, if you can take a look at this one, this is more on the overview of Medicare. So when you first turned 65, you got a red, white, and blue card that looked like this, that shows, get this out of the way. Hopefully are you guys seeing like interference on like from the controls from my Zoom, or are you able to see the presentation entirely?
Yeah, we can see it. I can see it.
Okay, perfect. Yeah, so part A is what covers hospital coverage. Most people who've worked 10 years in the United States, that premium is $0 for hospital coverage. And then there is a deductible for hospital coverage. That's assuming that you just have original Medicare. So what we're looking here is a coverage just if you only had the red, white, and blue card. And this is how it works. You'd have a deductible of $1,632 for each hospital stay. And then after that, if God forbid you were in a hospital for longer than 60 days, there are some pretty significant copays that get applied to the hospital stay. Again, inshallah, nobody needs to stay that long, but it happens. And when it does, it can become very costly if all you have is original Medicare. And then on Part B, most people are paying a premium for that is $174.70. If you have already your Social Security check coming in, it's just being deducted off of your Social Security check. In 2024, the deductible for Part B is $240 annually. So it's just one time in a calendar year for Part B. And after that $240 has been paid, at that point, the federal government is splitting the cost for your medical care at an 80-20%. 80% the government pays, 20% you're paying. But the 20% has no cap. There's no maximum limit on that. And so that can become very expensive for anybody who ends up having either significant outpatient surgeries or God forbid chemotherapy or anything like that. Those things can start to add up and it becomes very expensive. And then Part B also does not cover anything called known as excess charges, where certain doctors decide to bill higher than the Medicare established rates. If they do charge more than the Medicare established rates, the maximum they can charge is 15% in addition. And that is not covered by Part B as well. That becomes your responsibility. So these are what we call exposures in Medicare, where I have those yellow triangles with the exclamation marks. So you just want to be sure that you understand that if all you have is original Medicare, that you are subject to these exposures. And that's really where it comes into play, is how do you cover those exposures? And that's what we kind of walk through in this next slide here. One is on the left-hand side, you have original Medicare with Part A and Part B, and then you have those gaps, and the way to fill those gaps is you buy a Medicare supplement plan. The Medicare supplement plan is a very flexible plan that that you can buy and pay an additional premium, but what it does is, because original Medicare is widely accepted throughout the country and they don't work based on networks. So you can go to a doctor or a specialist in anywhere in the country, whether it's Johns Hopkins or Cleveland Clinic or Mayo Clinic, or what I'm starting to learn more about in our area in Southern California, whether it's UCLA Health or if it's Loma Linda Hospital, which have very renowned programs. They'll accept original Medicare with the supplement plan. There's no questions asked. There's no authorizations. Very, very flexible. You have no concern about getting a referral or anything like that. That's with the supplement plan. That's this on the left-hand side. The only thing is that this supplement plan comes with an additional premium above and beyond the $174 that people are paying. And then you have to buy a prescription drug plan separately. And so that's how original Medicare works. Very flexible in terms of the sense of how you see your doctors, but it comes at an additional cost. The Part C Medicare Advantage plan on the right-hand side, it takes A and B and it combines it into one program offered by a private insurance company. Basically, the federal government gets out of the business of paying the claims. They allow that private insurance company to take over, and manage the costs and the control. And the federal government actually pays these private insurance companies a certain fixed dollar amount. And then from there, those Medicare Advantage plans will do things like either an HMO or a PPO. They'll create networks and they'll contain costs, and they'll also have prior authorization requirements. So meaning that if you were given a treatment, even if the treatment was requested by your doctor, it now has to get approval from the insurance company before it can actually be authorized. Most times it's fine, it does get authorizations, but sometimes insurance companies do get in the way and say, hey, look, we don't think you need this treatment. And so then they either block it, and then you have to get your doctor to start submitting exception requests or appeals. And so that can take longer. On the original Medicare side, you don't have these problems. That is more of the thing that happens on the Advantage side. On the Advantage side, because they contain their costs with the HMO and the PPO networks, they are able to offer very low cost premium wise and copay wise. Sometimes even the premium is $0. They'll even throw in extra benefits sometimes where dental is included. Prescription drug plan is often included in these programs. So I kind of look at C as like C combines A, B, and D with some extra benefits at a very low cost, but they're also restricting some of your flexibility. And so I'll just show you this next slide, and hopefully this kind of hits home, and then I'll ask if you guys have any questions here. On the left-hand side, it's the same of what I just described. You have original Medicare, and in words, it kind of says no network restrictions, see most doctors in the country, no referrals required. Your costs annually are very predictable because it's just your premium, plus a low annual deductible, $240. And after that, everything else is covered. Hospital stays, labs, x-rays, see whichever doctor you want, so long as that doctor has agreed to take the Medicare rates, which is about 98% of doctors in the country, then that's what you would get on the left-hand side. Again, there is a cost, there's a monthly premium to it. You have to buy your prescription drug plan separately, so that's an additional cost. And if you wanted dental, you also have to buy that separately from a dental perspective on the left-hand side. On the right-hand side, Medicare Advantage plans, they have HMOs that have network restrictions. You have to have a primary care doctor to get you referrals to go see a specialist. Then when you get treatment requests from those specialists, they have to go through prior authorizations. If you choose to go with the PPO plan, you do buy yourself a little bit more flexibility, but there's basically like it's like a menu item of costs, like copays for your doctors are this, specialist is a different amount. If you go for a lab, an MRI costs more money, an x-ray will be a little bit less money. And if you go in network, it's cheaper. If you go out of network, it's more expensive. So it kind of becomes a little bit more complicated in understanding the cost, but they can be, if you're healthy, cheaper, give you some level of flexibility. But again, nobody knows what's going to happen tomorrow. But this one, oftentimes these plans are $0 premiums. They'll include those extra benefits. Part D is included. And so if you kind of just look at the difference between the two, I would say that the Medicare supplement plan offers fewer restrictions, but it comes with the higher monthly cost. And then the Medicare Advantage plan is more restrictions, more approvals, but has lower monthly costs. So I'll pause here. I know there's a lot of information in these last two slides that I went through, but any questions here?
Yes, I just want to ask you one thing.
Sure.
So that means you are suggesting that original Medicare with supplement like Medigap is better than this one?
It offers a lot more flexibility, Rananti, for sure. It definitely gives that. I can't say better because if someone is going to say, look, $100 to $200 more, maybe even $300 with prescription drug plan is too significant of a cost to take on a monthly basis, then it's hard for me to say that it's better. And especially if somebody isn't doing a lot of travel, or even if they get sick, they said, look, if I got sick, I'm not going to go to Cleveland. I'm not going to go to Johns Hopkins. And so then it's hard for me to say better, but I will say it offers more flexibility, if that's okay for me to say it that way.
Okay, so here it says low annual deductible is $240. $240 means we have to pay out of our pocket to get these things.
Yeah, so good question. Just to clarify from a definition standpoint, deductible basically means that the insurance is not going to start until you've paid the first $240. Once you've paid the $240, After that, then the insurance kicks in, and they're basically, in this case, every other cost after $240 is covered. You don't have to pay a single dime aside from your monthly premium for your treatment.
Okay. So
medical.
what my question is, I have Medi.
Mhm.
Like I have got these two cards. I don't know
Sure.
whether you can see them or not. Let me
Yep.
just show. This one,
Yep.
I have this card,
Yep.
and I have got this card.
Got it. Yep.
These are
I
the
can
two.
see.
Yeah. So for these two cards also, do you think that I would need to pay like $240 for annual or no?
No, so basically one of the things about on a supplement plan is if you have Medi, then you just stay on Medi. You don't get a Medigap plan. The thing with because there's an extra cost here from an agent standpoint, it's something that we could talk separately, but it doesn't make sense for you to pay a premium.
Oh, got it.
Because on Medi, basically the costs that are above the state's taking care of that to an extent, and so that's why. So it would be poor recommendation on my part, number one, and I'm actually not supposed to sell a Medigap plan to somebody who has Medi-Cal, basically.
Oh, okay. Okay,
Yeah.
got it.
But you have good coverage. It sounds like, so you probably don't run into a lot of these challenges. I don't know if you have an Advantage plan where you have restrictions, but it doesn't sound like you do.
I don't know what the Advantage plan like. I have really no idea about it. I have got this one though, like this one, like I'm on skin.
Oh, okay.
So-
So you have scan?
Yeah.
Okay. Yeah, so scan, then you're on a Medicare Advantage plan. And if is that working okay for you? Are you having any trouble seeing doctors, or is pretty good with work?
Yeah, so like you said, with HMO, we always have a problem because we have to go through our PCP to get the appointments of like different doctors. I wanted to go and see my gastroenterologist, enterologist doctor, and then I had to go to some other surgeon and those. But for that, I'll have to go to PCP first, and with her referral, then only I can see that, which is
Correct.
something like, So I don't know whether it is with scan only or with every other.
It's with all HMOs, and so scan only offers HMO plans today. They don't have any PPO plans, and they also don't offer a supplement plan. So we can definitely talk around on it if you want to see if there's other options that might be a little bit more flexible for you. And then you can get those things taken care of, and then you can maybe go back on the HMO afterwards. Those are options we can discuss for sure.
Oh yeah, I would love to see hear from you.
Inshallah. Yep, for sure.
Yeah.
Any other questions, guys? And then I just want to, from a definition standpoint, also want to make sure that everybody understands the difference between a copay and a co-insurance. Is that something that you guys are familiar with? Maybe a show of hands. Do you guys know what a difference is between copay and co-insurance? Sounds like you guys do or you don't.
So for copays, like sometimes like when I go to my pharmacy CVS, I have to pay for like sometimes $2, sometimes $3, sometimes even $4.
Right.
So for the medication which I am taking from there,
Yep, correct. So that from a definition standpoint, a copay is a fixed dollar amount. The insurance company has said this is what you're going to have to pay for this plan. It's a defined dollar amount. If it's co-insurance, then they're telling you it's a percentage of the cost. So that's the main difference. One is either a fixed dollar amount or the other one is a fixed percentage. And the fixed percentage means that whatever the charge is, it could be higher or lower, but it just depends on that amount that's being charged, and you're just simply paying a percentage of it, and they're and splitting the cost with the insurance company.
Got it. Yeah.
I see. I think Uncle's raising his hand. You want to go off mute? So you're on mute, Uncle. I can't hear you. Can you take the phone off mute?
Yeah.
There you go.
Scan plan also, and on the scan, memorial care, and so far found them excellent. no problem in getting authorization within a day or two. They're very prompt. This is only
Yeah.
people know, right?
Yep.
Only restriction is the hospital. There are only 3 hospitals. One in Long Beach, one in Fountain Valley, and one in Long Beach.
Right.
They're
Yeah.
Otherwise, it's a good plan. Right.
Yeah.
So, Javed, is it different? This memorial plan is different with the, I mean, different than what I have.
So
Like
you have
I'm on Hogue. I'm on Hogue.
You're with Hogue, yeah. So it's still scan. The network that you're working with is with the Hogue Memorial Group, or sorry, the whole Hogue Medical Group. And the plans are still very similar, but it's the reason why you're probably with Hogue is because your primary doctor is in Hogue. And like I said, most of the time, most Advantage plans will give you the authorizations, but it just depends on what's being requested. Again, this is also very individualized as well. But I don't know if you're running into problems with getting authorizations, but we can definitely talk about that separately. Just because, we want to keep it fairly general and not get too specific in anybody's.
Yeah, thank you. Thank you.
Yeah. Any other questions on these? Because I know, again, there's a lot of information here just to make sure that people understand what the differences are is the main point here. And I know timing wise, we're about halfway through, so I just wanted to be mindful of the time as well.
Javad, this is Rubina.
Yes.
We went through this process of original versus HMO. And for many years, we had the HMO plan. And then there came a time where we were advised to move to the original. So I think it also depends on your health, your need.
Correct.
Whether you need that variable. My question is, can you change independently from one to the other when the open enrollment is, or is
You could.
there requirements?
Yeah, you could. The one thing about the Medicare with the supplement plan, with all of this flexibility that you gain on the left-hand side, there are situations if someone's been diagnosed with something and you're well past the age of 65, where the supplement plan companies go through what's called underwriting. So they'll ask medical questions, whether or not you've been diagnosed with anything recently. Have you had treatment? Have you been hospitalized? What medications are you taking? And a lot of times, if there is something that's already recently happened, whether it's a stroke or if there's been a cancer diagnosis, these insurance companies can definitely have an option of saying, look, we're not going to take that risk and we're not going to accept you. And then you're basically stuck in the Advantage plan options only. You can switch from one Advantage plan to another, but you might have a difficulty going into a supplement plan as an example. And so there are some underwriting considerations to take into place. Now, if you're relatively healthy and maybe you're concerned about, hey, I don't know what's going to happen next year or the year after that, and you think you can pass underwriting, it's good to maybe take that as a consideration. It sounds like that's maybe what was recommended to you, and that's what got you into the supplement plan. There's one time in people's lives where they can get into a supplement plan regardless of their health, and they get accepted and with guaranteed issue. That's when you first turn 65 or when you first retire and you join Medicare. At that point, everybody has basically a one-time guaranteed issue right. There was one insurance company that for the last 3 or 4 years, every year at the end of the year, they would do something called an underwriting holiday, where they would say, we'll take anybody, even if you've got, even potentially terminal cancer or very bad cancer, they would take you in at the end of the year, and they would only have that window at the end of the year. This year, that company has become more restrictive, but there's still a window for us to do that. That's only in California, by the way. Other states, there's challenges, and it's not easy to get into these supplement plans afterwards. But again, that's also, I think, maybe it's a great question. Having that general discussion is very helpful, but if it's something that you want to look at, we can definitely take those options and consider them.
Thank you.
Yep. Any other questions? Okay, so this is kind of talking about how networks work, both from HMO and PPO perspective. In California, we have our HMO plans in California are different from other states, but the way it works is first, the insurance company and their HMO plans will create networks of doctors with medical groups. So these, you can excuse these medical groups. I was giving a presentation to some masjids in Arizona. So these are Arizona-based medical groups. But you can imagine Memorial Care in California would be one, Hoag would be another, Providence is another that people are familiar with at least in Orange County. And so the way it works is in an HMO plan, you get a doctor. And if, let's say, for example, let's use Dr. Adams as an example, if he's with Providence, then Dr. Adams can give you referrals to only doctors within the Providence medical group. He cannot go and say, oh, I'm going to send you to a cardiologist that's really good in Hoag. He has to keep within his own medical group. That's a California thing. And so not only are you restricted to doctors within networks, but then you become restricted to doctors within that medical group. Okay, so that's the way HMO plans work in California. On the PPO side, the flexibility comes in the sense that first, there could be doctors, and if they're in network, they just simply need to be in network. But Dr. Adams, as an example, could give a referral to Dr. Masood, who's in Memorial Care, and you can cross medical groups with a PPO plan. That's not a problem. Then they basically break out costs in terms of, is the doctor in network or is the doctor out of network? With a PPO plan, you have flexibility and you can absolutely go to a doctor that's out of network. The only difference is that you may have to pay more to see that doctor, either from a copay or a co-insurance standpoint. Same thing with hospitals. So like Uncle gave an example, with Memorial Care, there's 3 hospitals, but let's say, for example, he needs to go see a doctor that's in Cedars-Sinai in LA. And if they don't have that network connection, then he would be out of network. And on an HMO plan, he wouldn't even have the option to go there. He would basically bear the burden of the entire cost at Cedars-Sinai, minus the exception of an emergency situation. If you're in LA, something happens and you have to be taken in emergency to Cedars-Sinai, then that's fine. That's not a problem. But if it's a scheduled procedure or something like that and you're out of network, then you're going to bear the cost from an out of network expense standpoint. So that's kind of how HMO and PPOs work. Any questions on that?
No, pretty good.
Okay. So the next one is on prescription drug plans. This is where things start to get a little interesting in 2025. And it's actually a benefit for the beneficiaries, for people who are on Medicare. This is actually beneficial for you. But there's some implications to the insurance companies, which then kind of comes back around and has an implication on the beneficiaries as well. But first of all, just to give level set on a prescription drug plans, they break medications out into 5 tiers. Some insurance companies actually add a 6th tier. The 6th tier is actually a lower cost medication, very common medication that might be branded. But again, it's not with every insurance company. Tier 1 medications are preferred generics. Most insurance companies have either very low copays, like $5 or less. Oftentimes they're even $0 for those medications. Examples might be like metformin, rosuvastatin, atorvastatin, things like that are common use medications for either high blood pressure or for cholesterol or something like that. Then they have generic medication that goes up a tier. Those ones start to become a little bit more expensive, somewhere between $5, $10, or $15 for those medications for 30-day supplies. And then you have preferred branded drugs that would generally, the way I've seen those is anywhere from $35 to $50 cost. Again, it just depends on the insurance company. And then you start going into more expensive medication that's non-preferred drugs and then specialty drugs. So it's important to know that not every insurance company and every medication falls within the formulary of that insurance company. And formulary basically just means that the medications that are covered by that insurance company. Now, Medicare does mandate that every insurance company have a medication for a given therapeutic reason, so coverage-wise, right? So I'll use maybe a simple example might be like Ozempic for diabetes. Some insurance companies might say, hey, we cover Ozempic, but we don't cover Wegovy. Those are 2 different medications that are treating the same condition, but from 2 different standpoints. And so if Ozempic is covered, but Wegovy is not covered, but your doctor prescribes you Wegovy, then it's not going to fall within their formulary, which means now you're going to be responsible for the full cost unless you go back to the doctor and say, hey, no, prescribe me Ozempic. And so there's just some things to take into consideration. And those medications are fairly expensive. They usually fall into probably tier 3 and tier 4 medications. And so that kind of takes me into the next conversation about how formularies and the Inflation Reduction Act kind of come into play. So just at a very high level, for those who don't know, in 2022, Congress passed an act called the Inflation Reduction Act. It was a pretty broad act that got passed, but within it, somewhere in it, they had some things that were focused specifically for Medicare. And so those things started to roll out in 2023. So for example, if anybody remembers from before 2023, insulin costs could have been higher than $35, but in 2023, they put a cap and said medication for insulin, covered insulin by an insurance company, no more than $35 for a monthly supply of insulin. So they capped that. That was a benefit for a beneficiary. So you didn't have to spend more than that amount for your insulin for diabetes. Then in 2024, they did something to stabilize premium costs, and also they made it so that if someone had a lot of high cost on their prescriptions, after they spent a combined $8,000 on medication between themselves and the insurance company, then after that, the beneficiary's costs would all go to $0 in what we call catastrophic coverage. Now in 2025, this is where the big change comes in. They've completely redesigned the Part D prescription benefits. And it basically, instead of you waiting until you got to $8,000 of prescription costs before you went to zero, now they've set it so that the most anybody would ever spend in a given year would be $2,000 on their medication. And after that, you go into catastrophic coverage and everything is covered, $0 for the beneficiary. The reason why this change is so big this year is, one, alhamdulillah, it helps people who have expensive medication to know that the most they'll ever spend is $2,000 in a year. And if you're on a medication in January, you can actually put a payment plan in place so that it goes for the next 12 months. So you can divide $2,000 by 12 months and pay it off over the course of the year. But then it's also shifting the rest of that cost and that burden back to the insurance companies. And so what's happening when that cost goes back to the insurance companies, they're redesigning their formularies on where medications fall within different tiers and which medications are covered and which ones are not. And then for Medicare Advantage plans, they're actually reducing some of their benefits in some of the plans. So you might see like in 2024, you were getting, a certain benefit for dental, or you might have been getting certain benefits for extra benefits. Like sometimes they give grocery cards, or sometimes they give utility cards, those kinds of things. You might see those start to get reduced. Again, part of that is because they're taking on more cost on the prescription side. So they had to redesign it. And so the big thing is that I'll say some people were getting their annual notice of change. In previous years, there were very short notices on those notice of change. This year in 2025, people are getting 20, 23 pages worth of information of all the changes that are happening going into 2025. So that's the big thing. Because it's so big, people are getting confused. Am I in the right plan for going into 2025? Do I need to change? What's good? What's not good? Who's in network? Who's out of network? All those things need to be taken into consideration. And this one just kind of takes that view of how that cost works out. Annual deductible wise, the initial coverage of $2,000, and then after $2,000, it's basically $0. But I'll pause there. I know there's a lot of information here on prescription drugs. I would say probably 80% of people are on those lower tier medications, so they're not impacted. But those other 20% or so who are taking those more expensive medications, this is a benefit for them. Questions on any of this?
Yes, I do have. I'm again Fahmida. My name is Fahmida, and I had that United Health Plan that I talked about before. So each year, around for 8 or 9 months, I'm in the catastrophic phase, coverage, and only 3 months I'm paying very low copay. Like for example, I'm taking Xarelto and Entresto, and they don't have any generic. They are brand names. So I have to pay around $175 to $180 each month for the copay for each of them. But the rest of the 3 months, I just paid $35 or $36. So how can what can I do? Because those are really expensive.
Yeah, so that's a good question for me. Maybe it's good for us to get on a call and walk through the details of that, because with this change here, what was happening before, you were going through the donut hole phases. So in the initial coverage phase, you were paying the low copays. and that initial coverage used to go from basically the deductible amount $545 in 2024 all the way up to $5,000, and you were paying a copay while the insurance company was paying the rest of it. But
Right.
once that $5,030 was exhausted, and I'm not saying that you paid that, it was you and the insurance company that were both paying the retail cost of that medication that exhausted that $5,030, and then you went into what was called that the coverage gap. That's when your cost went from $35 all the way to $170 for
Yes.
about 3 months. And then in that 3 months, you went from that 5,030 to the 8,000, and then you catastrophic coverage. So then it went from 170 all the way to 0. So now what's happening in this year is they're basically saying, hey, you're going to get to $2,000 very quickly, and then it's going to go to $0. But when you get to $2,000, you're saying they're giving you the option now. It's called the M3P, Medicare prescription payment plan is what it is. So they're giving you a payment plan option to be able to pay the $2,000 over the course of the 12 months, because obviously $2,000 in one shot is a lot, but they know you're going to hit that. And after that, everything will be $0. And then for your particular medications, I think it probably makes sense for us to maybe have those conversations to find out which insurance companies have those particular medications in a tier that makes the most sense for you and also helps you with your costs.
Yes. So I
Yeah.
have to make appointment with you, right?
Yes,
On one
yes.
base. Okay.
Yep, exactly. Yes.
Okay. All right. I will do that. Thank you.
Yep, inshallah. Sounds good. It's a good question though. Any other questions that you guys might have about this? Yeah, there's a lot happening here, but I'll just kind of walk you guys back through these slides so you guys can at least see them. So we talked about tiers, we talked about the Inflation Reduction Act, and then the way the costs are sort of now broken out. No more donut hole. So anybody who was going through the donut hole and knew about it, going into 2025, alhamdulillah, there is no more donut hole. If you didn't know about the donut hole, don't worry about it. You don't need to know about it because it's not going to be there anymore. So alhamdulillah, you were able to not have to deal with the confusing aspects of that program.
That's good to know.
Yeah, alhamdulillah. Yeah, it's a benefit, like I said, for the beneficiaries. So this is, I think, one of my second to last slides. This is really about the annual notice of change that people got. And then as you take the considerations, I just want to make sure that when you're picking your plan and you think about the most important things, if I were to give you a recommendation, number one, first and foremost, if you have doctors and you're comfortable with your doctors and you pick a plan, you should make sure your doctors are in network. So obviously with the supplement plan, this is less of an issue, but for people who are on Advantage plans, make sure that your doctors are in network so you're managing your costs. Understand what the maximum out of pocket will be for you guys. Alhamdulillah, I'll just say that in California, and especially in Southern California, most of the Advantage plans have very reasonable maximum out of pocket. And for those who don't know what a maximum out of pocket is, that's the most that you'll spend on medical expenses. So whether it's doctor visits, urgent cares, emergency rooms, once you've hit that maximum out of pocket, after that, everything goes to $0 and the insurance company's on the hook for the rest of it. Like I said, in California, those maximum out of pockets are very reasonable. In other states, and like in Texas, Arizona, even in South Carolina, I see the maximum out of pockets are in the high four figures, meaning like over $5,000, $6,000, $7,000. In California, most of the plans are usually under $1,000. I see them as low as $199. Scan actually has the lowest one. I think it's $199. They might have even gone down to even $99. So it's very good with Scan. And so that's the maximum out of pockets. When it comes to premiums, that's obviously another thing to take into consideration. So if someone opts for the PPO plan because they want the flexibility to be able to go in and out of networks, there may be some premiums there. So that's something to take into consideration. And then understanding what the copays might be in your plan for, again, things like MRIs, X-rays, anything like that, that might be part of your coverage. Understand that. Understand what your deductibles might be. And then maybe even prescriptions should even be a little bit higher, but that's definitely something that's very important. Make sure all of your prescriptions are in formulary with the plan that you choose so that you don't get caught off guard, especially if you're already prescribed something. Now, if you're not prescribed a medication, obviously we can't predict what's going to be prescribed tomorrow or the next year or what new medications might come out. But again, just for what you know today, of what you're taking, it's very important to make sure that those medications are within the formulary of the plan you pick. And then the last one is, this is where I think most people gravitate to these things quickly is, oh, this plan has extra dental. It gives me this, but it gives me transportation benefits. Some plans are giving me money back to cover my Part B premium. They call it a give back, or it's giving utility cards or whatever, grocery cards. People run to those benefits, and those are the things that are being marketed on the commercials. But in my opinion, those should be the last things that you look at. First, make sure that your health is in good condition. The doctors are in network. You know what the premiums and your out-of-pocket costs will be, and your prescriptions are there. And then at the end, you can say, okay, I got all those things covered. Now let's look at these extra benefits. I'm not saying dental is not important. Dental is definitely important, but it might not be necessarily the top most important thing.
They have very minimum coverage for anyway, for the dental part.
Yeah, correct. Yeah, so there, yeah, and dentals are usually like, it's basically like a discount program for most part. But again, every one of these situations is very individualized. Somebody might say, hey, look, Javad, I don't even go to doctors, so I don't know who the doctor is in network, but my teeth definitely need to be looked at. So again, I don't want to diminish the importance of any of those other benefits, but again, it comes down to each individual and what you're looking for. This is just a recommendation and a guidance, if anything.
Good job.
Yeah. And then the last thing that I'll just mention, any of my services that I offer, all of my consultations, personal evaluations, any recommendations that I would make after we have our discussions, they are always at no cost to you. So there's no need to worry about paying for my services. The way that I get compensated is if you end up choosing a plan to change, when you do enroll, I ask that you enroll with me so that way I can get the commission on that sale. But the insurance companies will pay me. And the cost for any plan that you guys take, whether you take it through me, directly through the insurance company, whatever it is, those are fixed rates. So you're not going to pay more if you go through me or less if you go directly with an insurance company. So that's one thing. Again, no cost for my services to you. The next thing is if you ever become my client and you start to get bills or you have issues with claims or you need any other service, I'm always here for you. That's always free as well. I don't charge anything extra for that. Throughout the year, I'll be reaching out to you guys around your birthday, around Eid, around Ramadan, just to make sure everything is, set and you guys don't need anything. But again, I don't like sell the service or a plan and then all of a sudden become ghost and you guys can't find me anymore. I'll make sure that you guys always hear from me throughout the year and not just once a year. And then definitely like times like this, as we get into the annual enrollment period, I'll definitely reach out to you. My daughter's getting licensed, family's getting engaged as well. So alhamdulillah, as we get more clients, we'll definitely add more resources to our staff and team to make sure that we can help you guys all be able to make sure you have the proper coverages in place and also the proper amount of service from us so that you're covered, inshallah, for the lifetime. So my goal is always to not just win you as my client, but then also be able to keep you as my client with excellent customer service as well. So that's the end of my presentation here.
What's the best?
Thank you.
What's the best number to reach you?
So what I'm going to do is to Zainab, I'll put it on the screen here. So the very beginning, but with Zainab, I'm going to send her a link, to be able to book appointments with me. But here on this slide, if you want to just jot down the number right there in the front, that's my phone number and that's my email address.
Can I have a
You can also put it in the chat, Javad.
Okay.
Right. Okay.
Yes.
Good.
Yep. And then for anybody else who's happy with their plans, but any friends or family who are needing help and they're not on today's Zoom call, please, send them my information. They can always reach out and I'm here to help them. And that's the other thing is, as I started this business, my primary focus is to help our community. I'm not really going out and marketing my services to the other communities. While I can help anybody, but I'm really here to help you guys first and foremost, inshallah.
Thank you so much, Javad, for this talk. If you have some time, it's not quite 12. Are you okay taking questions if everybody has questions?
Yes, I have a question, please.
Yes.
I want to ask about like an HMO. Can I transfer it to Kaiser and is it better? I'm with Optum.
Yeah, so Kaiser is also an HMO. This is also a personal preference. If you like the Kaiser system, you can definitely change. But with Kaiser, you would have to change your plan. So it's a good time to change your plan to Kaiser now. My experience with Kaiser has been either people really love it or they really hate it. That's been my experience with Kaiser. And so if
I've been told by the friends that there's a lot of time for appointments in Kaiser for specialists. Very hard to get appointment.
Mhm.
That's what I've been told.
yeah.
But what
So,
other other we can
I don't have a good experience with Kaiser. I was on Kaiser for 10 years.
oh
So-
what about other things than Optum?
Yeah,
yeah.
I really like a scan. If somebody wants to try that out, nothing wrong with that.
But I'm younger than 65, so they are okay. Like,
Oh,
not-
you're younger than 65 right now?
yes, I'm 53.
Okay, so yeah, maybe Sister Nesri, you can maybe reach out to me and we can talk about options for your healthcare options. And we can find either a plan. Are you working right now?
Part-time, like
Okay.
part-time. 'Cause
Yeah, so we can look at options, but you might have HMO or PPO options. Maybe you might want to look at a PPO plan. Again, just depends on what your objective is and what your goal is. If you're having trouble getting maybe a specialist or something like that, we can talk about some options.
Oh, okay. Inshallah. And do you have to have renewal for medical every year, or it's automatic?
So Medi-Cal usually sends information in the mail to you, and they do what's called a redetermination. They just want to make sure that your income hasn't changed, and if it hasn't, then you should be good. With Medi-Cal, actually, in 2024, they took away any asset tests that they used to do to ask how much money do you have in your bank, how many extra homes do you have. They don't ask those things anymore. The only thing they ask for is how much money are you making every month or in every year, and then they base the determination on that. But it does go through a very I'll call it a relatively simple process. They send you something in the mail that you would fill out. It's called redetermination. They just want to make sure that everything is still accurate, and that's the renewal process.
Yeah. And do they have like they don't I want to ask like for medical, is there's any way if I transfer to PPO, this have different requirement, right?
Yeah, so if you're just
Income
on
wise?
straight, yeah, so and actually maybe it's best for us to talk separately about this, Sister Nasreen, but like I think with Medi-Cal, they have their own health insurance program if it's direct Medi-Cal. If it's something that's covered California, that's happening with what we call the online exchange, where there's some federal subsidy that pays for some of the premium, that might be a little bit different. You'll have some PPO options there as well. I just found that the PPOs are very expensive, but there are options there. And we can definitely talk about those, inshallah, if you want to get into some details.
Oh, sure. Okay. Inshallah. Thank you.
Yeah, good questions.
Very good presentation. Excellent.
Thank you. Thank you. Any other questions?
No, that's
Any-
all.
any-
Javad, thank you very much for being there for Olive. Thank you. Appreciate it.
Anybody just have like any recommendation for any like what another beside Optum
Our
instead of
scan is my personal experience
scan?
good so far.
Yeah, sure. But can they accept like someone with certain age, or doesn't matter?
No, it doesn't matter. And the scan, to my belief, and the scan has so many medical groups you can choose depending on where you live. In my case, the Long Beach is close by, so we went for Memorial Care. But there are a lot of options, prospects and other things right there.
Yeah, so the one thing about SCAN is it is a Medicare Advantage plan. So if you don't have Medicare, then it might not work. But Sister Nisra, if you have Medicare and you're under 65, that sometimes there are reasons why some people have that. There's very few limitations. I should say there's very few exceptions for that, but there are some exceptions. But if you don't have Medicare, then most likely you won't be able to get SCAN, because SCAN is not available for under 65 market.
Right.
Yeah, I don't have no.
Yeah.
But thank you, Jawad. Thank you very much.
No problem.
Jazakallah khair.
No problems.
Okay, Jazakallah.
Thank you, inshallah.
Good job.
Thank you.
Thank you.
I
Assalamualaikum.
think she has a question,
Oh,
Bibi Sayeda.
Okay,
She's on mute.
we'll wait for her. Can you, Sister Bibi, can you take off your phone off mute? You're on mute, so we can't hear you.
You're on mute.
Yeah.
There you
No,
go.
what I'm saying, you did a very good presentation, mashallah. I'm a SCAN member. I like SCAN. Mine says SCAN Classic. So I'll call you because I have some questions for you. And I'll call you. I'm going to see my mom in Canada, so I don't have much time when I come back, inshallah. It's before the
Inshallah.
enrollment period. But you
Okay,
did a very good
inshallah.
presentation. May Allah reward you in abundance.
Ameen, Jazakallah. Thank you so much.
Wa yakum. Assalamu alaikum.
Walaikum assalam.
Very much.
Safe travel.
Thank you everyone for coming today and listening to our Medicare workshop. Thank you, Javad, for this amazing presentation. I think there was a lot of good information in there and a lot of new things that we might have not known about the new enrollment period and the new programs that were passed. So it is 12 o'clock, so I just would like to thank everyone for coming today, and hopefully we see you guys on our Wednesday program, where we'll be talking more about Medicare and the plans and preparation, but that program will be in person. So if anybody is interested in that, that's going to be in our Anaheim location. Other than that, thank you guys so much. Have a
Thank you
wonderful
very much. Thank you.
Okay.
Thank
Okay.
Olive Community Services is a 501c3 nonprofit organization based in Southern California that provides culturally appropriate services to seniors, their family, and the community. Through its physical and virtual interactive programs, Olive engages participants in a variety of ways that promotes health and well-being. To learn more about Olive Community Services, to get involved, or to make a donation, please visit www.olivecs.org or email info@olivecs.org. Be a change maker, and together, let's live, learn, and thrive.